Hi, this is your Governor Albert Bryan Jr. And while we've been fighting the coronavirus for the last several weeks, that doesn't mean that we've left everything else behind. See, we are preparing for an even larger crisis in the form of the economic downfall that will happen as a result of the virus. Time waits for no one, and although this is a time to stay at home, we have been out preparing for our return to the new normal. There's a lot of work before we get to shovels in the ground, and our engineers, procurement people, and administrators are working hard to get these projects to completion. The world pandemic is trying its best to delay our progress, but we will not be deterred. We are continuing with our plans to tear down the remnants of the hurricanes and rebuild new schools, a new hospital, and infrastructure that will serve our territory for years to come. We are moving ahead on all our projects and ensuring that we not only keep our recovery on track, but that we keep our commitment to improving our beautiful Virgin Islands. Good day, Virgin Islanders, at home and abroad. I trust that you had a restful weekend. Today is Monday, May 4th, and today we are currently tracking 11 active cases of COVID-19 in the territory. So far, we have had tested 1,046 individuals for COVID, and of those, 965 of those tests came back negative, 66 came back positive, and we have had 4 fatalities. As of this morning, we have 15 tests pending. There are 3 COVID-19 patients in the hospital at JFL, one at Louis and St. Croix. One of those patients is on a ventilator, unfortunately. But the good news is that we expect the discharge of one of those patients today. Later on today, they will be getting out of the hospital. Currently, there are no COVID patients being tracked at the Roy Lester Schneider Hospital in St. Thomas. Those of you that follow our numbers really closely recognize that since last Thursday, we have tested 130 individuals, which yielded 130 negatives. That's a 0% positive rating. That's a really good sign. And I just wanted to highlight all the good news today. But this was a high level of testing. This high level of testing that we had was definitely an aggressive contact tracing effort in response to a small surge that we were seeing in St. Croix. I think it was a good exercise because it proved 2 things. One, it proves that surges happen no matter whether you're locked down or you're not. So last week, we were at a stay-at-home order, and we still had a surge, but very quickly, we were able to test a number of individuals. I think we tested over 300-400 individuals total last week, and get to a point where we actually get beyond the disease and get negative tests coming in at 100% of all the people we test. So the second thing I think it does is it shows that we could rapidly deploy our resources. We could get our contact tracing, get it down, and get it out very quickly. This is one of the advantages that people in the States don't have. I mean, this is a very small territory, and usually quite quickly we can track down where a person's been, who may be affected, and get them tested and isolated from the rest of the community. This weekend, we also passed another landmark for COVID. Now we've moved past 1,000 tests. We have tested approximately 1% of our population. And as we've been aggressively testing wider and wider ranges of people, we expect that to go to 2 and 3% rather quickly. Today begins our new Safer at Home order, in which we are allowing certain non-essential businesses to resume their operations as long as they can adhere to the safety guidelines that were issued by CDC and our local Department of Health. These non-essential businesses include barbers. You can see my hair is cut. I did that first thing this morning. Hair salons, massage therapists, gymnasiums, and private healthcare facilities for elective surgery and medical visits. And during the weekend, I listened to the radio and monitor social media. Of course, many of you have inboxed me, texted me with your concern. And I understand the high level of anxiety regarding the reopening of leisure businesses, such as movie theaters and bowling alleys. But our team, trust me, always has a plan. And what we did is we had the same level of concern that you had. And we knew that these types of businesses would cause some alarm in the community. But we also put in the caveat that none of these businesses could open without serving of food and drink. See, that's what concerned us the most. I was a little bit shocked to see people in restaurants in the States, and those states that have reopened sitting down, because either you're not protected by the mask, you're ingesting food, and especially in a theater and bowling alleys, you have a tendency to have finger food, French fries, chicken, and drinking, an easy way for the virus to be spread. So when we thought about how we would open these places safely, we wanted to make sure that people weren't sitting, eating, and drinking, exposed to anyone that could expose them to the COVID virus. But however, just to get a little bit more information about that, last week we approached several of these businesses and the management to see how they planned on coming up and opening these stores without entertainment, without violating any of our social distancing or our masking, facial mask guidelines. Caribbean Cinemas, who operates all of the theaters in the Virgin Islands, have notified us that they're developing a protocol at this time, and they don't anticipate opening before June 1st. So the theaters, I don't think we're gonna have any movie theaters open before June 1st. Also, the fact that there are not that many releases coming out now. Tropical 10 Bowling, they are no longer opening up either. They are working to make sure that they have protocols where they can keep people safe. And of course, Chicken and Bowling in St. Thomas, we were advised is no longer in business. So they won't be opening up their bowling alley at all. Within our executive order, we also notified the public that all the gaming centers and the casinos would be closed. We don't want people sitting around pulling on machines or doing VLTs, at least not yet, at least until we get to June 1st, and then we'll take another look-see about what we do. Now remember, any resident who wishes to patronize any establishment at all must wear a facial covering to protect themselves and others. Every one of these establishments must provide for safe physical and social distancing and ensure proper sanitization of all their equipment. We also want to make it clear that ski masks are prohibited both indoors and outdoors as means of addressing the need for a mask in a commercial establishment. That's full head coverings with just the eyes. Those are not approved of and should not be worn into establishments nor in the public unless you're doing some kind of work or stuff in an industrial setting where you need to have that type of protection. Your mask should look like just like mine and cover just your nose up to probably the middle of your nose bridge and your mouth. We have some special guests here today to show you how to put on those masks properly. We did not mention it before, but this weekend I noticed and this morning that taxis, safaris, and cars for hire, you are considered commercial establishments. If you're going to get on a taxi, on a safari to go somewhere with other people on it, you need to wear a facial covering while you're in or on these vehicles. In addition to our new stay-at-home order, or safer at home order, we're calling for residents to wear facial coverings whenever entering establishments, except for children who are under 2 or individuals with acute respiratory issues, asthma, and the like. We made accommodations in our executive order last week to make sure. I had a number of calls from the clergy asking me how they were to conduct sermons with facial masks, so we made an adjustment to that. Now you can conduct the sermon without a facial mask, but you need to be 10 feet away from the congregation, and you need to stay 10 feet away from the congregation at all times. Once you move from giving the reading or what have you, then you are to return your mask in its place and have a seat. Otherwise than that, you're to stay 10 feet, that's 10 feet away from everybody. We have also taken the liberty of printing signs at Property and Procurement. They're called No Mask, No Service. We did this as a free service to businesses. Those are available in Property and Procurement offices in Subbase, as well as the Department of Licensed Consumer Affairs in St. Thomas. Tomorrow, I'm going to say 3 times, not today, those masks will be available in St. Croix at PMP, Property and Procurement in Richmond, along with DLCA. We also have distributed them to police officers and other personnel who traverse the community to kind of give those out to businesses. So it says prominently on there who should be wearing masks and why, and who to report them to. I'm asking the public's assistance to report violators who are not businesses who are choosing not to implement the mask, no mask, no service policy. You can do that by calling Licensing and Consumer Affairs at 713-3522 or 714-3522. So that's 713-3522 or 714-3522. So any violations that you find on there, please report them to DLCA. We still enter into this, as I keep telling you, the economic crisis following this health pandemic is going to be a lot worse than the pandemic itself. It's going to last a lot longer, and we're going to feel a lot of pain economically as a result of that. So we've been doing a lot of things to help the public. One of them, you will see, those of you who've gotten your bills are going to get your light bill this week. You're going to start to see that credit on there for the Yes, Your Economic Stimulus, that piece where we paid the light bill for commercial and residential establishments. We are now have, I think it's 7,000 applications for unemployment. I do caution the public in using that number. Some of them may have been duplicated, as some people filed online and still filed paper applications at the office. So we're working diligently to get those cranked out. At this point, we're at 2,430, so about a third of the way through. And we cranked out about $1.7 million in checks, and we continue to cut checks every single day, trying to get up to where we have everybody paid and squared away in terms of the unemployment checks. I have some very good news for you. Last week we had a lot of controversy around the stimulus checks. And our team worked very hard with Treasury to figure out something, and I'm happy to announce that as of this morning, we actually have our plan for payment approved by Treasury. We're anticipating by sometime late next week, we'll be turning out those checks. We haven't gotten the money yet, but this is welcome news because it's way ahead of the plan that we actually put together. So IRS has been working with our local IRB to making sure that we get those funds into the territory and get them out to you, hopefully as early as late next week. But the bad news is we're still having some challenges at the Social Security Administration and the IRS in terms of determining how we pay those recipients who are on Social Security. What we want to tell our Social Security payers now, that if you haven't filed a tax return for 2018, you should go ahead and just file a 1040 on that, so we can at least have a record of your name, any dependents that you may have that will entitle you to the extra child credit. And we'll have more information once we have a solid plan, but like I say, it can't hurt to go and file your 2018. You could note on there that you're a Social Security recipient, so they know how to do that. We identify you so we can get a check out to you as quickly as possible. More good news. I guess it's Good News Monday. As part of the CARES Act, it has been made available to us to participate in the school lunch program. It's the extra food benefits program. And this is welcome because, you know, as we get closer and closer to summer, we always worry about how our young people are going to eat. We know that a lot of families have been challenged by this pandemic, so we want to make sure that we're getting those out. I have Commissioner Gomez here with us today. She's going to talk to you a little bit about that and how these pandemic EBT cards will work. They will be issuing them to you. They'll come with a certain dollar amount per child. And if your child is in a public school, you think you've already been registered. And if you're in private school, you would have been given an opportunity to register. If not, you need to call your school. Once they are eligible for school lunch, they're eligible for this programs. I welcome all of these different benefits that are coming down the line. It's very important for us to recognize there are a lot of families in our community that need the extra help, and we're trying to get out these funds as quickly as possible. You know, I have my constituents and my stateside Virgin Islanders who sometimes are more engaged than we Virgin Islanders are in the politics and everything that goes on here. And a couple of them called me last week just to tell me that, hey, you know, I live in the States and I haven't gotten my check yet. A lot of us have not gotten their checks, so the Virgin Islands is quite on time in trying to get things out. There's a lot of people who have Social Security, who have checks, who have stateside accounts, have not gotten their stimulus funds yet. So as soon as we get that check, we'll be getting it out to you. But please remember that this virus is not going anywhere, not anytime soon. So we cannot hide from it. Rather, now it's about learning how to live with it until at some point a vaccine or an effective treatment is available. This foundation that we are laying in our phased approach on reopening is just that. It's a foundation, but it's a firm foundation that will help to build the pandemic policy as we go down this strange new road. There isn't an on or off switch or magic button that we can push that will make it all perfect. We simply must trust our experts and that we, as an administration, are making our decisions based on the best information we can get. Certainly, everyone has an opinion on how we do and what we do, but many of these opinions are sadly uninformed. The decisions that we make are based in two things: a solid commitment to keep you informed, and an even firmer one to make sure that you and your family are safe. I want to remind you that the public, all of you listening to me in the public, that if you or someone in your family is experiencing symptoms of fever, shortness of breath, dry cough, chills, loss of taste or smell, especially if you have recently traveled out of the territory or come around somebody or been around somebody who has been out of the territory, please call the Department of Health hotline. I want to say that again. If you know someone, even if it's a cough, it's a sore throat, don't hesitate. We have enough testing to make sure that you don't have the COVID-19, or if you do, to be able to isolate you. We've created all kinds of safety nets to make sure that we could provide you with the testing, provide you with the last time or whatever it is to make sure that you are okay. Even if you need to go someplace else from your family, we can assure you that we can give you that peace to isolate yourself. Because any hesitation of you to be diagnosed puts our entire community in jeopardy. Any hesitation of anyone who may have this virus, we need to know immediately. So please, reach out and call that hotline. The quicker we diagnose people, the quicker that we do the tracing. The quicker we do the tracing, the less of an impact it is on our entire community. Thank you. I'm going to remain around for some questions, but now I'm going to have Commissioner Gomez tell you the good news about EBT. Commissioner Gomez.
Thank you, Governor. Pleasant good afternoon to everyone. May is a big month for the Department of Human Services, as many of our department programs are celebrating National Recognition Months. Additionally, the Department of Human Services, the Division of Family Assistance, is diligently working with our federal partners as we are eligible for the PEBT, or Pandemic EBT program. We are in contact with and working with eligible private and public schools to collect family data and create a plan to roll out the program. What is PEBT? PEBT is an abbreviation for Pandemic Electronic Benefit Transfer. It's an additional benefit that basically provides food assistance via an electronic benefit card that can be used in participating grocery and convenience stores for food items. PEBT was funded by the Federal Families First Coronavirus Response Act. Benefits are now available for all Virgin Islands SNAP and non-SNAP households with children who are enrolled in grades K through 12, who have temporarily lost access to free or reduced price school menus due to the pandemic related to public and private school closures. Families who have children enrolled in the private schools eligible for PEBT should have likely been called on by their respective school staff obtaining additional information. It should be noted, however, that the VI Department of Education has coordinated with us, the Department of Human Services, to share this information, the students' information, which is collected on our management information systems. When will it roll out? The timing is determined by our federal partners as we work with them to put out all the details of the program in place. Our hope is to issue the PEBT benefits to the eligible families around mid-June. We will provide clear details as they become available and the firm date is set. Eligible households will receive their PEBT cards in the mail, and for those current SNAP recipients, your additional PEBT cards funds will be added to your SNAP card. Who will get the PEBT card? SNAP and non-SNAP families whose children attend the VI public schools in grades K through 12 will receive SNAP EBT cards. However, you do not have to contact your schools or the Virgin Islands Department of Education. All children in the public schools are eligible for free school lunch and are eligible. Families with children who attend private schools, which are eligible for federal free and reduced school lunches, will work with their respective private schools to submit documentation needed by the department. Department of Human Services is working directly with the private schools to collect that data. Families cannot individually apply for PEBT with the Department of Human Services. So if you have questions, please contact your private school directly to see if you have eligibility. If you've followed your school directives and have school-aged children, K through 12, who qualify for free and reduced lunches, PEBT benefits will be available to households regardless of immigration status, and a PEBT card will be mailed to the address that you've provided to your school. The size of the PEBT issuance to each family will be based on the number of school-aged children in the household and determined equal to the federal reimbursement rate to the U.S. Virgin Islands for breakfast and lunch at the free rate, as specified by USDA. Please note that the PEBT benefit through the Virgin Islands Department of Human Services is separate from the current VI Department of Education breakfast and school lunch program that is currently underway. It will be in addition to those lunches and as a food shopping benefit. You will be able to get both of them. The Department of Human Services is not currently taking calls regarding PEBT as the schools are leading the charge in collecting the family data. Parents whose children attend private schools, K through 12, who are eligible for the federal free and reduced lunch may call your school if you have questions. Please note all children K through 12 who are enrolled in the VI public schools are automatically eligible, and you don't need to call us. When details have been finalized with the USDA, Food and Nutrition Services, regulating the program, we will announce those details and the timing to ensure that everyone knows and when they will get their cards and benefits and how to utilize them. In closing, I'd like to thank the leadership and staff within the Department of Human Services who are essential workers and continue to work night and day for all Virgin Islanders. As May is National Foster Care Month and Older Americans Month, we want to also thank the individuals and families who offer their homes and time and resources to support our effort to provide safe spaces and places for the most vulnerable children in our communities. We also want to honor the seniors in our territory, upon whose shoulders we all stand together today. Every May, the Administration for Community Living leads our nation's observance of Older Americans Month. The theme for 2020 is Make Your Mark. This theme was selected to encourage and celebrate countless contributions that our older adults make to our communities. Their time, experience, and talents benefit family, peers, and neighbors every single day. Communities, organizations, and individuals of all ages are also making their marks. This year's theme highlights the difference everyone can make in the lives of older adults in support of caregivers and to strengthen our communities. We also extend our appreciation to all the nurses who serve in our homes for the aged and our senior citizen affairs programs and throughout the territory as Nursing Week begins next week. Finally, we want to honor and thank our correction officers during Correction Officers Week this week. Like I said, it was a busy month. It is our collective honor as Department of Human Services to work together to make a difference. Thank you all.
That's a whole lot, Commissioner. Thank you for that. You don't realize that all those different people work under Human Services, a very wide department. So we know we are asking everybody to wear these facial coverings. So today we have a special guest from the Department of Health, Kathy Arnold-Lewis, who's also a nurse and everything else, and she's going to teach you how to put this mask on and take it off without infecting yourself. So, Nurse Lewis.
Thank you, Governor. I'm Kathleen Arnold-Lewis, a designated safety officer under the Department of Health, and one of my roles is to teach donning and doffing. So here I am. First thing I want to emphasize is anytime you handle your PPEs, make sure you clean your hands. So I have just cleaned my hands with the sanitizer. So make sure you get a sanitizer, maybe 70%, 60% and up. I have several masks here on the table if it can be shown. Can we see these okay? And the reason why I brought a couple, because we have these surgical type masks and masks such as what the governor has that has not the N95 qualifications, but are masks nonetheless to contain droplets. And we're going to go through both. And these are both different styles of N95 masks, which a lot of people talk about on the media. So the N95 masks come in different sizes, shapes, and making sure that you are aware of that there are variations to that. How you know is on each of those masks usually have N95 on it, and that'll be the differential for knowing which mask is what. Let's go to the surgical mask. Many people have the mask that goes around the ears. You're going to open your mask up. Make sure you have clean hands. Make sure you pay attention. There's a metal device usually inside the top or bottom. Some masks have top and bottom, but the ones that have it on the top only, that's the area that has to go to your nose piece or the bridge of your nose like the governor was referring to earlier. So you're going to don that. And a lot of times you open it up because you want to create a pocket. You want to breathe. And you want to place that. If you have glasses like me, you have to tuck it under your glasses, around your ears. You just want to secure it. Just make sure it's open and make sure you contour that metal to your face. The key is you want to decrease the amount of air coming in through your areas here that's open. You want to decrease your air going out in case you're a person who's a carrier. So that's the key with that. Remember now, when you're taking off these masks, you keep your hands on the straps, okay? Because your face, the face of this mask is contaminated or considered contaminated. But I know there's challenges around masks and the supply of masks, so you want to try and secure your mask and maybe use it again, like I just used this one time. So you want to make sure the outside of the mask does not touch yourself and others, and surfaces as well. So you want to be careful where you place your mask. Ideally, you want to take your mask, you want to fold it away from you, right? Put your contaminated area inside, and then you want to put that in a secure location where you use a Ziploc bag or a plastic bag, and then you're going to place this in my purse so I could use it when I go out to my next establishment. Everybody get that? So that's one thing. So that's the regular surgical mask. When you're dealing with your N95s, and I'm just going to demonstrate one, both of them are similar, it's just some different colors and different shapes, but you have fixed ones like this, and they're also collapsible ones. I don't know if you've seen those ones in a packet that's actually flat. Those collapsible ones you can actually fold and put away. These should not be collapsed, because collapsible ones, you don't want to destroy the fibers in the mask, okay? So you want to keep the integrity of the mask going. So on this one, you're going to put your top strap. Again, your hand sanitize, make sure you do that. And you put that on the crown of your head, or I consider it the crown, on top here, across here. Make sure your straps, whatever you can do to make it more secure. Then you're going to take your other strap, you're going to put it behind and put it on the back of your neck, or the nape of your neck I have here. So, and again, you're going to make sure you mold it to your nose. And with this, you want to make sure you have as least amount of air coming out through the sides, okay? The whole thing. Again, you're going to take this off, not touching the face of the mask, okay? But more taking the straps off, okay? And you want to take it off again, okay? Like in this case, I would love to save this mask, because this is like probably $5 if you go like somewhere local, right? And so you want to kind of secure it and put it in someplace safe. More than likely, if you're going to wear it short term, you want to put it in someplace safe, tuck it away, because I'm going to put this in my purse now to use further. So you don't want to have your face of your mask here contaminated in other areas. You don't want to lay it down, so you want to try and secure it in some plastic. And that's it for your demonstration.
That is great. I always wondered with the double one, when they go in front, you put it over your head, so you learn something every single day. So that's how you put on your facial coverings. I guess we're going to open it up for questions. We have 3 of them burning. So let's try that today. We'll see if Ernest gets cuts off today. We're looking forward to hearing him, because he always has a question or two.
Good afternoon, Governor. This is Sarah Burke with TV2 News.
Hi, Sarah.
How are you?
Good, good.
My question, in terms of, this question is for the Commissioner. Good afternoon, Ms. Gomez. Commissioner Gomez, hope all is well.
Yes, thank you. Good afternoon.
You have made reference to the PEBT. All public school students are eligible, but yet still some discretionary measures in reference to private school students. So when will parents know that private school students will be eligible for these type of services? How do we go? You said to contact the school, but then how is the school going to know if these funds are made readily available? And what does this private school need to provide the agency to be eligible for such services for their students?
The private schools already know if they are eligible for free and reduced lunch. And there's only like 3 or 4 that are excluded from that list. And so the schools already know. And so they should be in contact with you via, whether it be email, however their communication is done. That's usually how it's been done for them. If they have any specific questions, you can call your school to see if you're eligible. But they should have been in contact with you already.
Okay. And then lastly, how soon will these PEBT cards will be issued? Do you have any copy in terms of time frame?
I'd like to say June. We are in the discussions with our federal government. I really wanted to give everybody the opportunity to understand and make sure that they were contacting their private school just in case they had not heard for whatever reason. We want to make sure that everybody that wants it or is eligible for it is able to obtain it. So we're aiming for June. We just want to make sure that it's okay with our federal partners.
Thank you so much, Commissioner, for
My
all
pleasure.
that you do. I wanted to take the opportunity, Commissioner Gomez, to just say thank you. Thank you for working feverishly to making sure that people receive the services that they're entitled to. Thank you so much, and have a great day. And
Thanks, you too.
Thank you. Next question. Go ahead. Hello, go ahead. You go to the next question. That's it? Next question. No other questions? That's a miracle. No questions coming in. Go ahead.
One thing I'd like to emphasize is before and after you do your doning and doffing, you make sure you use your hand sanitizer. So I didn't demonstrate using the hand sanitizer after I took off the mask, but make sure that you do. Make sure you do. And I did afterwards, but you didn't see that part.
And there you have it. Best of a Monday to you as we press forward. I know this weekend I got a lot of calls on the beaches again. We had a briefing with the police commissioner, and he said for the most part, there are a lot of cars on the beach, but people are staying within their family groups. We continue to have some problem beaches, most specifically Lindbergh and St. Thomas, as well as Rainbow Beach in St. Croix. We're not going to waste a lot of resources on this. So what we're going to do is just close the beaches that we're having problems with. That way we don't have to deal with it, because the police have a lot better things to do than police people who are putting their own lives in danger on the beaches. As you know, we always have a lot of scarce resources in this community. So thank you to those of you who are cooperating. I like to reiterate again, there's no sale of alcohol on the beaches. We did not include no drinking of alcohol on the beach in the last executive order. But if we have to step back and look at that again, we're going to do that. But our approach, if we can't get some cooperation from those in the public that continue to violate, not only are we going to arrest people, but we just close those beaches. So be safe out there. Like I said, today is the first day of our Safer at Home. And remember, you are always safer at home. There's no reason that you are compelled to go out. If you have to go out to the grocery or to work or wherever, that's fine. But we made no such order making anybody do anything that they don't want to do. We simply lifted the restriction that compelled them not to have their businesses open. So as we go through the week, I ask for you to remain in compliance with our social distance, wash your hands, sanitize, stay off the street as much as possible, wear your mask in every establishment. God bless you. God bless the Virgin Islands. Please stay tuned for the Spanish version that will come right after this broadcast. Good evening.
He escuchado de muchas preocupaciones y ansiedad con respecto a la reapertura de negocios de ocio como cines y las boleras. Nuestro equipo siempre tuvo el mismo nivel de preocupación con respecto a este tipo de negocios y anticipo que no abrirán sin poder servir comida y bebida. Sin embargo, para obtener más información la semana pasada, nos acercamos a la gerencia para ver cómo podrán operar dentro de las pautas sociales de distanciamiento de esta pandemia. El Caribbean Cinemas nos ha notificado que están desarrollando su protocolo y no anticipan la apertura antes del 1 de junio. La única bolera, Tropical 10 Pins, ha indicado que son incapaces de abrir en este momento y continuaremos trabajando con ellos para desarrollar protocolos que mantengan al público seguro. Dentro de nuestra orden ejecutiva, también exigimos que todos los centros de juego y casino permanezcan cerrados. Residentes que deseen patrocinar cualquier establecimiento deben usar máscara facial para protegerse a sí mismo y a los demás. Cada uno de estos establecimientos debe proveer para un distanciamiento físico y social seguro y garantizar una desinfección adecuada de todos los equipos. También queremos dejar claro que las máscaras de esquís o de esquiar están prohibidas tanto en interiores como en los exteriores, como para abordar la necesidad de una máscara en los establecimientos comerciales. No lo mencionamos antes, pero los taxis, safaris o coches de alquiler se consideran establecimientos comerciales y todos los ocupantes deben tener máscaras. Además, nuestra nueva orden de seguro en casa llama a los residentes a usar máscaras al entrar a todos los establecimientos, excepto para niños menores de 2 años o individuos con problemas respiratorios agudos. También hicimos un alojamiento para que los líderes religiosos puedan dar el sermón sin máscara, siempre que se mantengan a 10 pies de distancia de la congregación. Hemos imprimido rótulos sin máscara, sin servicio, para las empresas. Estas están disponibles en la oficina del Departamento de Propiedad y Adquisiciones y las oficinas de Licencia y Asuntos al Consumidor en San Tomás. Estas estarán disponibles mañana en Santa Cruz. Si bien estas nuevas directrices se aplicaran estrictamente, estoy pidiendo la ayuda del público denunciando a cualquier infractor. Puede hacerlo llamando al Departamento de Licencias y Asuntos del Consumidor al 340-713-3522 en Santa Cruz y en San Tomás al 340-714-3522. Al entrar en esta nueva etapa en nuestro camino hacia una nueva normalidad, también debemos proteger el bienestar económico de las familias de las Islas Vírgenes. Tengan la seguridad de que seguiremos haciendo todo lo posible para proteger la salud pública y el bienestar de todos los virginisleños. Seguimos haciendo un buen progreso, procesando 2.430 cheques que nos llevan a un acumulado de $1.7 millones. Tengo buenas noticias y malas noticias sobre la distribución del pago de estímulos según las Islas Vírgenes. Recibí la noticia esta mañana de que Rentas Internas de los Estados Unidos ha aprobado nuestro plan de pago de impacto económico que despeja el camino para recibir los fondos en nuestra tesorería. Con esta aprobación, esperamos que la primera ronda de cheques se emita en algún momento en la próxima semana. La mala noticia es que todavía estamos teniendo problemas con la Administración de Seguro Social con respecto a los cheques de estímulo directamente a los beneficiarios de las Islas Vírgenes. Todavía no tenemos una decisión final, pero actualmente estamos aconsejando a todos los beneficiarios de Seguro Social que presenten una declaración 1040. Si tiene alguna pregunta, comuníquese con la Oficina de Rentas Internas al 340-773-1040. Más buenas noticias, una parte de la ley CARES se ha puesto a disposición de los niños que participan en el programa de almuerzo escolar, beneficios de alimentos adicionales. Estos beneficios alimenticios se conocen como Pandemic EBT o PEBT y deben ser alrededor de $300 por niño. Las familias recibirán una tarjeta PEBT por cada niño elegible en el hogar que se utilizará en alimentos y comestibles. La comisionada Kimberley Causey-Gomez proporcionó más información y responderá a cualquier pregunta que puedan tener. Recuerde que este virus no va para ninguna parte, sino esto se trata de aprender cómo vivir con él hasta que en algún momento una vacuna o un tratamiento eficaz se haga disponible. Nuestro enfoque escalonado sobre la reapertura es solo eso, una base firme sobre la que construir una política o guías de pandemia a medida que avanzamos por este nuevo y extraño camino. No hay un botón mágico que podamos oprimir que nos lleve a la perfección. Simplemente debemos confiar en nuestros expertos. Estamos tomando nuestras decisiones basado en la mejor información que podemos obtener. Ciertamente, todo el mundo tiene una opinión, muchos de ellos tristemente desinformados sobre lo que hacemos y cómo lo hacemos, pero todas nuestras decisiones se basan en hechos y un compromiso sólido para mantenerlo informado y seguro a usted. También quiero recordarle al público que si usted o alguien que conoce está sintiendo síntomas de fiebre, dificultad al respirar, tos seca, escalofríos o pérdida de olfato y sabor, especialmente si usted ha viajado recientemente al territorio o ha estado alrededor de alguien que tiene el virus, por favor llame a los números de la línea directa del Departamento de Salud. Cuanto más rápido diagnostiquemos a la gente, más rápido será el rastreo, menos el contagio y menos el impacto en nuestra comunidad. Gracias. Tenemos aquí a la señora Lewis que nos va a demostrar el uso de las mascarillas o las máscaras.
Hi, good afternoon, everyone. I'm Captain Lewis. I'm a Safety Officer for the Department of Health.
Buenas tardes, estoy. You have to say it a little bit shorter so that I could be able to translate it for you, if that's okay. Estoy con el Departamento de Salud, para abreviarlo.
Today I'm going to demonstrate to you the wearing of a surgical mask and an N95 mask.
Hoy les voy a demostrar el uso de la mascarilla N95 y también la mascarilla de uso para el uso.
First thing I want to make sure that everybody knows the hand sanitizer and hand wash prior to donning your mask.
Antes de utilizar una mascarilla, deben utilizar entonces algo que desinfecte sus manos.
And I'm first going to demonstrate the surgical mask, which looks like this and kind of looks like the ones people have cloth masks that are wearing.
Las máscaras de cirugía, esa va a ser la primera que le voy a demostrar.
First thing you want to make sure is that you have the mask going in the right direction.
Tiene que asegurarse que tiene la máscara en la dirección apropiada.
And then you're going to open your mask,
Va a abrir la máscara.
making sure in the case of manufactured masks, there's a metal piece that goes around the top.
Muchas veces tiene un área donde tiene metal. Esa parte va entonces la parte hacia arriba.
So you're going to put that over the face,
Va a poner eso sobre su cara
straps around the ear,
y entonces el enlace sobre las orejas.
and mold the wire or the metal piece around your nose.
Y la parte metal entonces la va a moldear sobre la nariz.
Make sure it covers mouth and nose.
Por favor, cerciórese de que entonces cubra su nariz y su boca.
When you're disposing, you want to hold on to the
Cuando,
strings around your ear.
cuando vaya a quitarse la máscara, entonces tiene que sujetarla sobre la área que va alrededor de la oreja.
And the key is to try not to contaminate anything with the front of the mask. That's considered dirty.
Y la clave es no contaminar la parte de al frente de la máscara, ya que la parte del frente de la máscara está contagiada o podría ser contagiada.
Okay, and after you take that off, you're going to hand sanitize.
Después que se quita la máscara, entonces utiliza el desinfectante.
In some cases, you may need to store that mask.
Algunas veces, ¿verdad? Muchas veces tienen que entonces asegurar esa máscara para entonces poder continuar utilizándola.
Here I have two different types of N95 masks.
Tengo aquí dos tipos diferentes de máscaras N95.
And how you know they are N95 masks versus a regular mask
Y como tú sabes que es una máscara N95,
is most N95, I'd say all N95 masks have actual N95 on the mask.
usualmente, bueno, todas las veces, entonces indica la máscara que es una N95.
Again, you have this metal piece on the top.
Otra vez va a tener este pedazo de metal sobre la parte de arriba de la máscara.
You're going to put the top strap over your head.
Lleva la parte de arriba entonces sobre su cabeza o el elástico sobre la cabeza. Y el elástico en la parte de abajo entonces también se la lleva sobre la cabeza.
And again, you're going to mold the metal to your nose.
Otra vez va a moldear entonces la parte de metal sobre su nariz.
So you're trying to make sure that it fits as snugly as possible so air doesn't escape or come in.
Va a asegurarse que entonces la máscara le quede bastante apretada, cuestión de que no entre ni salga ningún aire por alrededor.
And then you're going to take the mask off, just touching the straps only.
Solamente va a tocar el área del elástico para quitarse la máscara.
And then you're going to take your bottom strap off.
Va entonces a sacar primero el primer elástico de arriba sobre la cabeza y después el elástico que está en la parte de abajo de la máscara.
You can dispose of
puede entonces descartar entonces o botar la máscara en un plástico. Yeah, that's okay. You can see. Después que se quite la máscara, de nuevo, utilice el desinfectante para las manos. Gracias a ustedes.